Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
And welcome back to Life Unrehearsed. My name's Matt Delvecchio, specializing in life transitions, elder care planning in the senior living industry.
And I'm Corrie Sirota, clinical social worker and author of Someone Died, Now What?
You know, sometimes we have to tackle the tougher subjects on Life Unrehearsed, and we have not been afraid to do so. One of those topics that for some, it's a difficult topic, being palliative care. And some people just aren't comfortable with this type of conversation. There's a bit of a stigma, wouldn't you say, Corrie, about that?
100%. We don't. You've heard me say this many times before, that we live in a death-denying society. So it's no different when it comes to someone's terminal illness or severe illness and what kind of support one would need is palliative care, and yet we don't want to talk about it. So that's a problem, and that's why I'm grateful that we do talk about it here today.
Yeah, and you know, there are some hidden treasures, and we really wanted to get some awareness to what is out there, because palliative care has come a long ways. And so let's bring in Dale Wheel. Dale's been involved with the Teresa Dellar Palliative Care Residence and Foundation for the last 12 years, having served on both boards in various capacities since 2009. And Corrie, your very first show 5 years ago, almost last week, was with Teresa Dellar.
Right.
You know, fun fact. And in 2018, Dale played a significant role in helping to create the Montreal Institute for Palliative Care and has been executive director of both the residence and institute since January 2020. Dale, welcome to Life Unrehearsed.
Thank you very much, Corrie and Matt. Happy to be here.
Yeah, well, thank you for coming on the show. So important in our mind. And for those that may not understand what palliative care is, how would you define it?
So palliative care is basically, it's an approach, and it focuses on improving the quality of life for patients and for their families. And these are for people who are no longer seeking a cure, no longer undergoing treatments for what can be a life-threatening illness. So it basically prevents and relieves suffering, and that's suffering whether it's physical, psychosocial, spiritual. Many people actually think palliative care is just something that happens at the end of life, but in fact, people can be palliative for years if they've chosen to not to undergo any more treatments, but would rather just manage their symptoms and make the best out of the quality of life that they have. And that really means, focusing on quality of life, good symptom control, focusing on the whole person and what matters to them, and addressing their needs, whether they're medical, spiritual, social, intellectual. It's all about respecting those, their autonomy, their choice, their dignity, a lot of listening, sensitive conversations, and it also does involve support for families, both through the journey of their loved one and thereafter.
Just that definition alone is really so important for people to understand. And I want to tell you, as you've heard, I've been in this industry, the grief, loss, and bereavement industry for a long time, and I was not clear. I was one of those people that thought palliative care was just end-of-life support. And what I'm learning, both professionally but also personally, watching some of my friends work as helping their families out, for example, I'm seeing that it is a long-term support in a very humanistic way, very compassionate and empathetic way. So you mentioned the families. What are some of the challenges for families dealing with palliative care?
So it's a great question. Most families that have been taking care of a loved one at home, or maybe they've been bedside with them while they're in a hospital or a long-term care setting, where there's some limitations to care. These people are exhausted. They're struggling with how to provide or fill in for the care of their loved one. They've lost their place as a wife or a husband or a parent or a child because they're carrying this burden of caregiver, and they suffer from guilt, feeling of inadequacy. They're often confused, exhausted, and they really struggle with observing a decline and a suffering of their loved one and feeling a little bit helpless. And certainly if their loved one's in a hospital, they're worrying about what's happening when they're not there. And if they're at home with them, they're worrying about decisions that they need to make when the clinical caregiver isn't there. And the chances are that those people are not getting any kind of psychosocial support as well. So the burden that they feel is overwhelming, and they've already started to grieve.
Listening to Life Unrehearsed with Matt and Corrie, and we're talking palliative care with the executive director of the Teresa Dellar Palliative Care Residence, Dale Wheel. Now, Dale, I want to talk specifically about the Teresa Dellar Palliative Care Residence, a gem in the West Island. How can it help families and their loved ones in palliative care?
So I'll just mention, since 2002, because we're 20 years old this year, we've been providing what I would call a very safe home-like space where patients and families receive compassionate care. They're treated with dignity. They find comfort and peace, and they really feel at home. When someone's admitted to the residence, it is because the level of care they need is just not possible, and they typically come to us. Families are overwhelmed with the caregiving, and they basically can hand that care over to us and stop worrying about that and become the spouses or parents or children or friends that they were. And the healing actually begins as we support them. And what we do is we take time to support the person, the patient, what's important to them, what are their goals, and that becomes our compass for how we're going to take care of them. Often they're coming from a place where their disease has been the focus, but with us, they are really the focus. So we have a team of doctors and nurses and patient care attendants and social workers, art therapists, music therapists, and they all come together as a team and practice whole person care, contributing to what's important to that patient. And then while, of course, the core of the care is the comfort and symptom management and spiritual support for our patients, we're also supporting families from the moment we welcome them to the residence. And while we take care of the families upon admission of their loved ones, our support for them continues long afterwards. We have bereavement calls that can last up to a year, and we hold bereavement groups throughout the year for children and adults, young adults, more senior adults, and these latter things are open to anyone in the community because it's a huge need. But I'd want to say that our care, which is central, is complemented by a number of other elements that actually play an important part in providing comfort and well-being. So I'll name a few. Art is very important. It's in and of itself very therapeutic. So we have beautiful art, which has been carefully selected from donor artists and curated by a group called Art for Healing. And it's extensively throughout the residence for everyone to enjoy. And we also have an art therapist who provides art therapy either in the patient rooms or in our art studio, where patients and families can create legacy projects and express themselves in many ways. Music is very present from the moment you come to the residence, and we have volunteer musicians playing the piano regularly, often with several patients gathered to listen. Our music therapist works directly with our patients at bedside. We'll find and play for them their favorite tunes on guitar, engage them in discussions about lyrics, or even in playing their own musical instruments or singing, and they've even sometimes composed their own legacy songs together. Nice. Food, of course, is a big sense of comfort, and we have a motto in our kitchen, which is never say no. So every day brings a new menu of homemade foods, and we make a point of integrating people's favorite dishes that we've discovered, which can bring back memories of their roots, their first dates, their childhood, and many people come to us having stopped eating, so they find their appetites again because they find themselves eating what they want, right, not what they should, which happens sometimes in other environments. And every afternoon, mid-afternoon, we have volunteers who circulate from room to room with a tea trolley, and they offer tea and homemade cookies to families. And on Fridays, it's actually a wine and cheese trolley, so that's very popular. And you can't imagine how these little gestures are so appreciated, and they just make people feel special.
Yeah, I imagine so, and I know that you're clearly very, very excited about the program and what you do. Unfortunately, as much as I'd love to hear more about it, I'm going to thank you and mention that this is a nonprofit organization, and so it is. Please, I want to thank you. Thank you for sharing what you have told us about it.
Yeah, and Dale, just to reiterate to listeners very, very quickly, because everything you've talked about is at no charge for families. So you have to rely on donations. Very quickly, how can people donate and contribute or even volunteer?
Well, thank you for asking, because this is all free, and we're highly dependent on both volunteers and donors. And the easiest, and we have about 180 volunteers today, but we can always have more. So best is to just Google Teresa Dellar Palliative Care Residence, which will lead you to the website, and there's there's an onglet which says, "How can I help?" and you'll discover how you can either donate or volunteer or both.
All right.
Thank you so much. That's Dale Wheel, the Executive Director of the Teresa Dellar Palliative Care Residence and the Montreal Institute of Palliative Care. Coming up, we will continue our conversation on palliative care as we bring in the leaders of St. Raphael Palliative Care Residence based right in the heart of Montreal. Welcome back to Life Unrehearsed. I'm Corrie Sirota along with my co-host Matt Del Vecchio, and we're talking about palliative care and some of our hidden treasures right here in Montreal to help people who are experiencing long-term illnesses and imminent deaths. So in order to do that, we're going to bring on Olivia Levesque, Executive Director of St. Raphael and Palliative Care Home and Daycare Center, and Veronique Desprez. They are directors of the multidisciplinary services of the Day Center. So I want to welcome you both to Life Unrehearsed, and I'm going to direct my first question to Olivia. Please tell us about St. Raphael Palliative Care Residence.
Hi, thanks for having us. So, yeah, of course, St. Raphael's is one of only 2 palliative care homes in Montreal with Teresa Dellar, which we just heard from, and the only day center for now. We are a nonprofit community organization, and we offer free, amazing multidisciplinary care and services to people living with an incurable disease, their loved ones, and also the bereaved. What else? Our hospice floor allows us to welcome 12 people living with a terminal illness, so a prognosis of less than 3 months, and their loved ones. We have an amazing team, including physician everyday, nurses, PADs 24 hours a day, and many other palliative care professionals, like social worker, massage therapists. They'll explain very well what hospice is. As for the day center, we offer what we call early palliative care and services to people living with incurable disease, caregivers, and we also offer bereavement services. So the services are really offered based on people's needs assessment. We offer the same range of services to people living with the illness as we do to their loved ones or the bereaved. So, that's it. We can welcome up to 25 people a day.
Well, it's amazing. It's certainly it's unbelievable, really, as you explain everything. And I think people have no idea, as we talked about our hidden gems. Veronique, we're going to bring you in here. And Olivia mentioned early palliative care. That's kind of a new term that I'm not familiar with. I don't think many people are familiar with. What does early palliative care mean?
Right. Well, it is. It's a new concept. Yes and no. It comes from the UK, so it's in Great Britain. It's been there for several years, maybe 30, 40 years. But in Quebec, it's fairly new. And usually, when we think of palliative care, we think of the services that are offered at the very, very end of an illness. Early palliative care, it kind of says it. It's really introducing all of what palliative care has to offer, but as soon as somebody is diagnosed with a terminal illness, and many of the people that we welcome at the day center are still undergoing treatment. So what comes to mind, would be people with metastatic cancer, but are still undergoing treatment and would come to the day center. Unfortunately, the palliative word, really, it's a scary word because we still, unfortunately, associate it to the end stage or
That's
even
right.
death. And so, it's our struggle here at the Day Center has really been to relate that message that it's really not for people that are at the end of their life, not at all, in fact. And so we really want people to come and to benefit from our services as soon as they can, so that we can provide them with all of the services that we offer with a multidisciplinary but also a holistic approach to patients and families.
I'm going to interrupt you. I'm sorry, because we got to
sure.
get in some questions here. We want to know a little bit more about, I understand the residence is free, and also there's lots of texts coming in, so I'm going to try and put something together here.
Sure.
So what the cost is, and you were speaking about also what the admission process is, because someone has asked about if a person how are they evaluated and how can they be accepted?
Sure. So, well, there's many questions there. So, just for the cost, just to clear that one out, it's very simple. It's free. So there's absolutely no cost. Even we provide meals. People can come have a meal at St. Raphael's at the day center, or they can even pick up a meal after they've had, let's say, a massage or an art therapy session. They can take the meal to go for themselves and for their families. So all of that is totally free, thanks to our donors. And the admission process is also fairly simple in a sense that people can just call up St. Raphael and just make an appointment with myself. Usually, I meet people for the first time just to make sure that they fit the admission criteria, which is either being someone with a terminal illness or being a caregiver or somebody facing loss in the context of a palliative care setting. And then after sitting with them, it's a space where we discuss their needs. It's also where I describe all the services that we offer, and we start from there. So it's very simple. We also have a form that's online, so some people prefer to fill in the form and send the form in. They can be referred, obviously, by a healthcare professional, but we've our very short history, because we're open since November 2019, has shown us that the best referrals are really when people just pick up the phone and call themselves because they know what they need, and so that's usually the best way.
You're listening to Life Unrehearsed. Matt Delvecchio and Corrie Sirota. We're talking palliative care with Olivia Levesque, Executive Director of the St. Raphael and Palliative Care Home. And you just heard from Véronique Després, their Director of Multidisciplinary Services and Day Center. Corrie, the texts are coming in. My goodness, we were a little shy, perhaps, of bringing up this topic. And obviously, it's resonating with a lot of people. A difficult subject, obviously. We're running out of time. Olivia, very, very quickly. Again, this is no cost for staying at the residence. It's so amazing. Again, you also need to be funded. And how can people donate and contribute to the residence?
Sure. It's very easy. Actually, you can just Google St. Raphael Palliative Care. And so on through the website, it's very easy, maisonsaintraphael.org, or you just can call. So it's very easy. And people can donate time also. We need volunteers.
All right. Well, thank you very much to both of you for coming on Life Unrehearsed.
Thank you so much. Thank you.
All right, this is Olivia Levesque, Executive Director of the St. Raphael and Palliative Care Home and Day Center, and Véronique Després, their Director of Multidisciplinary Services and Day Center. All right, Corrie, already done. We're at the end. What do we have coming on next week?
Next week on Life Unrehearsed, learn why comedy gives back is no laughing matter. And November is Fall Prevention Month, so we'll be talking about some of the 17 most popular reasons why people fall and what they can do to prevent them.
Yeah, it's amazing. We've got two wonderful guests talking about fall prevention. And we want to thank you for tuning in to Life Unrehearsed. And as a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, be my pleasure to help. Call me at Lianas Senior Transition Support at 514-622-8074, or simply look us up at Lianas Senior Transition Support. And many thanks to our technical producer, Max. Great job. Thank you. You can listen to Life Unrehearsed here on CJAD 800 every Saturday at